Hello, I'm sure you've heard about PCOS, polycystic ovarian syndrome. It's all over the place. So if you have that or you know someone who has it, please draw close because I'm here to break it down for us. So feel free to share this with anyone you know who may be affected by polycystic ovarian syndrome. So what is it? It's a hormonal condition, and we all have hormones, which are chemical messengers, that do different functions in our bodies, and we need them to work properly so that our bodies can function well. But in this condition, PCOS, the hormones make the ovaries grow lots of small cysts, which are like tiny bubbles filled with fluid. So these cysts can make it difficult for women with PCOS to have regular periods, when your periods are all over the place. It can also make you have things like extra hair on your face, on your body, or it makes you struggle to lose weight. So polycystic ovarian syndrome was first recognized by two American physicians called Stein and Leventhal. So it was initially called Stein-Leventhal syndrome. And they had described what they had noticed, the symptoms of amenorrhea, so lack of periods, hirsutism, excess growth, hair growth, and enlarged ovaries with multiple cysts. But now we call it PCOS, so polycystic ovarian syndrome. And we've understood a lot more about it, and we now know it's such a common condition affecting mainly women of childbearing age, so in their reproductive age, that's when it affects women. So it's believed to occur in about 10% of women of childbearing age all over the world. So it is common, and it can vary based on things like your genetics or the diagnostic criteria being used. So over the years, we now see a lot more of that. I don't know if it's because it's occurring more people have PCOS, or because we are getting better at diagnosing it. So we've always sort of believed it was a condition to worry about when you're, wanting to bear children during your fertile years. However, now we know that there's so much more to PCOS. It actually causes a lot of long-term serious health risk conditions like type 2 diabetes, endometrial cancer, that's womb cancer, and also cardiovascular diseases like heart attacks and stroke. So how do we diagnose this? How would you as a patient know that you have PCOS? For us to diagnose it, you need 2 out of 3 things. Number 1, you need to be someone who has irregular periods, or your periods don't even come at all. There are some women who for months they won't have a period and they're not pregnant. So you need that, okay? Or you're not getting periods at all. Number 2, you need an increase in facial hair. You have lots of facial hair. Some women do have heaps of, chin hair, body hair, okay? Or we've done blood tests to show that your male hormones, the androgens, example of which is testosterone. So we do a blood test and we see that the testosterone level is raised. So we need that. Or thirdly, you need an ultrasound scan showing that your ovaries has lots of cysts. Cysts are like bubbles on the ovaries, okay? So if you have 2 out of 3 of these, we say you have polycystic ovaries. So why do people develop polycystic ovaries? We're still not sure why, but a number of reasons have come up to try and explain why people have PCOS. Number 1 is hormone imbalance. So sometimes our bodies make too much of the male type hormone, the androgens. Like I said, an example is testosterone. So when you have high levels of the male hormone, it can make it harder for the eggs in your ovaries to grow and develop like they should, and get released for you to get pregnant. The other factor is genes. It seems to be more common in some families. PCOS seems to run in families. So just like we inherit our hair color, our skin color from our parents, the same way it seems that PCOS runs in families. But as of date, we are still not sure what the exact genes that cause PCOS, okay? Now, the third thing is insulin problems. Insulin, remember insulin? Insulin is a hormone that helps our bodies to use sugar. What we eat is insulin that comes up to take the sugar to get it into our cells so we can use it. But if you have excess insulin, these high levels of insulin actually stimulate cells in the ovaries to produce more of the male hormone testosterone, which then makes PCOS worse. The other thing people are thinking is inflammation. Inflammation is when your immune system is overactive, is overstimulated, so your body is like inflamed. This can affect how your ovaries work and actually contribute to PCOS. Another factor is lifestyle. Eating so much unhealthy food or not getting enough exercise. We're also sedentary. We're seated for long hours. We're seated, watching TV, seated, working, whatever it is. If you're not very active and you become overweight, then that can also lead you to PCOS. Okay, so those are some of the reasons people have mentioned. Now, we're going to use 4 different women to try and explain a bit more about PCOS. So please pay attention. Let me know if any of these women's stories resonates with you. We want this to be as helpful and as practical as possible. So the first woman we'll consider is a young girl. Let's call her Emma. She started her periods when she was 11. Everything was going well, periods coming regularly like clockwork. But 2 years afterwards, she noticed that her periods were irregular. Sometimes they were late, other times they were really heavy, as in drenching, soaking through her clothes. And she would get a period maybe every 3 to 4 months. So that made it hard for her to plan her activities, as you can imagine, or to focus on school. And then she started getting really horrendous pimples, acne on her face. We know that with puberty you can get acne, but hers was on another scale altogether. Of course, that made her self-conscious, that affected the way she saw herself, and she eventually came to the doctor and she was diagnosed with PCOS. So she was given hormonal treatments, a lot of support to stay active, stay positive, healthy lifestyle, and all that really helped. So in Emma's case, it was the irregular periods and the skin problems that led to her diagnosis of PCOS. Okay, now let's consider another woman. Let's call her Sophie. She's 24, 25, thereabout. So this lady, she's always been very energetic and active. But in her early 20s, she started feeling tired all the time. She also noticed that she was gaining weight, and even though she ate healthily and exercised regularly, the weight just kept on coming. Her periods were irregular, making it hard for her to plan her routine, as a nurse. She felt frustrated, worried about her health, as you can imagine. Eventually came to the doctor and she was diagnosed with PCOS. So a lot of discussion about how this would affect her fertility in future. She started on treatment, learned more about lifestyle changes that could help her feel more energetic and manage her weight. So in Sophie's case, it was the weight gain, the irregular periods that took her to the doctor, and she was eventually diagnosed as having PCOS. Okay, let's take another woman, this time someone in their 30s. What shall we call her? Let's call her Lily. So in Lily's case, she always wanted to have children. She always dreamt about having her own family. But she struggled with infertility for years. She's been married for 4 years, no kids, despite trying everything she could. Her periods were irregular. She had lots of facial and body hair. Of course, all that made her feel self-conscious and worthless. She and her husband tried for a long time to try and conceive without success. So they eventually visited the doctor. They were diagnosed with PCOS and explained how this affects your fertility and makes it difficult for you to get pregnant because you're not ovulating. Of course, that was devastating for her. But eventually, with a lot of support and fertility treatment and lifestyle change, she was able to have a baby. So that was fantastic. Okay. So in Lily's case, it was the infertility and the facial hair, body hair and all that, in addition to tests, that led to her diagnosis of PCOS. Does this resonate with you? Are you out there suffering from infertility, wondering what's going on? You might have PCOS. So let's talk about another patient, Eva, in her 40s. Let's say she's 43. So she is a teacher. She loves teaching and just, getting on with her career. But she approached her 40s. She noticed changes in her body. She was gaining weight more easily. She struggled with mood swings. Her moods were all over the place. And on questioning, I found out that she's always had an irregular period. She's never actually had monthly periods, and she assumed it was normal. There are people like that, they're not getting periods, and it comes every 4 months or thereabouts, and they actually accept it as just normal for them, and she's never had a pregnancy. So, she was diagnosed with PCOS. So we discussed how that can continue to affect women even into their 40s, causing hormonal imbalance and other health implications. So it's not just about the fact that you're not having regular periods, it's all the other things that go with it. So with medication, with lifestyle change, she was able to help herself. So in Eva's case, it was the weight gain, the irregular periods, the infertility that pointed to her diagnosis. So in these 4 scenarios, you can see that PCOS affects women differently at various stages of their lives. It can impact your physical health, your emotional well-being, your fertility. So it's really important, if you're having symptoms, to seek medical advice and support so you can manage your condition effectively. So which of these women's stories do you resonate with? I would love you to share in the comment section, okay? So I'll be watching your comments. Please write something. Let me know which of these stories sound like what you or your sister or even your daughter is experiencing, okay? So let's talk about why it's important to be diagnosed. If you have the condition, we don't want you walking around not knowing what you have. It's really important to have it diagnosed for the following reasons. Firstly, it can cause years of misery. You can imagine if you've been infertile for many years, not realizing you have PCOS, it can cause you body image issues or the hairiness, and it can predispose you to high blood pressure, to cardiovascular disease, things like heart attacks and stroke. It can make you diabetic. You can have sleep apnea. Sleep apnea, you're sleeping and then suddenly you stop breathing. And then you start breathing again. It's quite scary for people's spouses, It can also cause obesity. You can have womb cancer, which is a really important one. So let's talk about diabetes for a moment. 1 or 2 women who have, out of 10 women who have PCOS, will go on to develop diabetes at some point. If you have PCOS, your risk of developing diabetes is increased further. If you're over 40 years, you have relatives, that are diabetic, you had diabetes during your pregnancy, what is called gestational diabetes, or you're obese, so you have a BMI over 30, that puts you in the obese category, okay? So high blood pressure, heart disease is also means you're likely to become diabetic. So women with PCOS tend to have high blood pressure, which is likely related to their high insulin levels. They have insulin resistance, and to being overweight rather than just the PCOS itself. So high blood pressure can lead to heart attacks, can lead to heart problems, so should be treated. Okay, now cancer, let's talk about the cancer bit of it. If you're having fewer than 3 periods a year, it means the lining of your womb gets really thick, and they can get so thick, this can lead to womb cancer in a small number of women. So really important to have periods to shed the lining of your womb at least 4 times a year, 3 to 4 times a year. So it can also, PCOS can predispose you to mood swings, to depression. It can affect how you see yourself, how you think others see you. It can lower your self-esteem. So snoring can cause snoring, daytime drowsiness, makes you fatigued because you're not sleeping properly. During the day you might feel sleepy too. Okay, so what can you do to reduce long-term health risks? Please don't give up. I know it sounds like do all doom, but you can improve your chances of long-term good health. Number 1, by having a healthy lifestyle. I can't overemphasize on that. And the main way is to reduce your overall risk of long-term health problems and to eat a healthy, balanced diet. This includes foods like vegetables, some fruits, whole foods that are actually food that you can recognize, not processed food. Avoid over-processed food. Eat your brown rice, your whole wheat pasta, lean meat, fish, especially the oily fish, chicken. You should also cut down on the amount of sugar, salt, and caffeine you eat and drink. Exercise at least 30 minutes on 3 to 5 days of the week. We can all do 30 minutes of exercise, I promise you. Okay, so aim to keep your weight at a level that is normal. Keep your BMI between 19 and 25. If you're overweight, it's helpful for you to lose weight and maintain your weight at a lower level. The benefits of losing weight include you will lower your risk of heart disease, you will lower your insulin levels and your chance of developing diabetes, you will lower the risk of cancer of the womb, you will have more regular periods. I see people that have had period problems for years, but once they lose weight, their periods start behaving itself. And before you know it, they get pregnant. So it will increase your chance of becoming pregnant. It will reduce acne and decrease all that hair you have, okay? It will improve your mood and self-esteem. And the good thing is that you only need to lose a small amount of weight, about 5 to 10% of your weight, to make all this huge difference to your symptoms and your health. That's fantastic, isn't it? So have regular health checks. What do you need to check for? Your weight, your height, calculate your BMI with this, your waist circumference, okay? And check your blood pressure. Do a blood test to check the cholesterol, your what we call a lipid profile. Check your blood sugar. Avoid smoking. Avoid smoking like the plague. I'll do another clip on smoking and vaping. So please subscribe to my channel. There's so much to learn, okay? You'll find out why I prefer people to vape. I'll tell you all about it, okay? So keep an eye on your mood because you'll be prone to depression and anxiety if you have PCOS. Some people develop eating disorders and body image problems. We want to avoid cancer of the womb, like I've explained. It's important to have a period every 3 to 4 months at least to reduce your risk of excessive thickening of the lining of your womb. If you've not had a period for over 4 months, you may need tablets, hormone tablets, to make you have a period. Okay, so you can shed the lining of your womb. We may also offer you a scan so we can look at the womb, make sure nothing nasty is happening there. Okay, so how do we treat PCOS? It's not curable. We can't cure it as of now. Maybe science will find out later on. But you can treat the different symptoms, okay? So one of the main things we use are hormone treatments. One is a combined pill, because that way you regulate your period and you shed the lining of your womb regularly. The other things, we could also give you tablets called progesterone. That's in the mini pill, progesterone tablet. You take it for a few days and stop, you have a bleed. Okay, so that way you're shedding the lining of your womb. Or we could fit you with a Mirena coil. Mirena is the hormone coil we put in the womb. That way your linings of your womb won't even thicken, you know. So that protects, is really protective. So those are sort of hormonal treatments we use. We can also use a tablet called metformin. Metformin has been used for diabetes for many years, so it's an old drug. It's actually not licensed to use it to treat PCOS, but we can have that discussion, and you have to be sure you're willing to use something that is not licensed. But metformin reduces your insulin levels, and that will help you to lose weight. It will regulate your period, your fertility problems may be solved. It will reduce the amount of testosterone, that male hormone you have. We also have tablets that tackle the testosterone, things like finasteride and spironolactone. These can reduce the male hormone level in you and improve your acne and your skin spot and your hair growth and so on. Okay, so these are all medical treatments we can use to manage and reduce the symptoms of having of the PCOS. But I want you to note that medication alone has not been shown to be better than healthy lifestyle change. You're still, if you want to go down the healthy lifestyle route, that will also work perfectly. Okay, so many women with PCOS successfully manage their symptoms and long-term health risk without medical intervention. They do this by eating a healthy diet, exercising regularly, and maintaining a healthy lifestyle. So the other way we can also help with the PCOS symptom is for people to have weight loss surgery called bariatric surgery. And this may be considered if your BMI is so high, you might need to have surgery, okay? To help you, the bariatric surgery will help you lose weight and improve your PCOS. So please go for it if you're really struggling and you have a high BMI and you're infertile, for example. Okay, so PCOS is a frustrating one. And oftentimes your doctor will say, go and lose weight. But we know it's not that straightforward. I have a whole series on losing weight. So check it out on my website, okay? So, and your lack of fertility can make you feel unworthy, can wreak havoc with your mental health. The excess facial hair, the body hair, and all that can be a nightmare. But even deeper than those outward things are the health problems like the diabetes, the womb cancer that can result from PCOS. So I hope this video has opened your eyes to PCOS. Please speak to your doctor if you have the symptoms I have mentioned here. And let me know in the comments section if you have PCOS. How are you dealing with it? How is it affecting your daily life? And also, let me know if there's any medical topic you would love me to break down. Okay, as a family physician, I deal with all sorts of illnesses within the family. That's what family physicians do. Okay, so let me know. I'll do a video on your on the medical condition you want. Subscribe if you haven't, because there's so much to learn. You've got this.